Welcome back to my channel. If you're new here, my name is Neil Galvin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you're already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos Mondays, Wednesdays, and Fridays. Please make sure to subscribe now. You hit the notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, you guys, let's jump into the video. Hi everybody, welcome back to the last discussion for this week. And kung hindi mo pa napapanood yung other nursing videos, yung lecture materials I created for this week, I actually discussed about the spinal cord and the WBC, differential laboratory values. I'll be putting the actual playlist link on the description box or whenever the icon button pops out. Check the one out because I'll be putting it there together with the other playlists I have on my channel, including the playlist for nursing test banking, and this is one of my most popular video playlists of all time because I know that this type of videos where I teach you how to approach and attack certain questions in the board and NCLEX examinations is really beneficial to those who are trying to take their licensure examination. And I created a lot of nursing test banking videos for all of you guys. Please make sure to check them out, answer them, put your scores on the comment section below so that I can evaluate and use them to your advantage. All right. Now, I would like to grab this opportunity for thanking you for tuning in today and for showing up for our today's class. You guys did an amazing job. I want you to get your pen and paper because in a moment we're going to we're going to start our discussion. Now, I would just like to grab this opportunity to invite you to follow me in all my social media accounts. The links will be on the description box. This video presentation, this video class discussion is also going to be uploaded on my Facebook page. It's Neil Galvin Official. Yeah, I think it's Neil Galvin. And share them and tag your friends, your classmates, your colleagues. Let them know about this channel that we have on YouTube. And I would like to invite you also to check out my podcast channel. It's 3 a.m. Conversation with Neil Galvin. All right, so if you haven't watched the other nursing test banking videos I created, I'll be putting the links on the description box and the icon button. The icon button. If it pops out, check them out because that's for you. What is wrong with me? All right. After this, I am going to grab myself some coffee. So this is going to be quick and let's begin. All right, let me share to you the objectives for our today's discussion. I'm going to provide and discuss board exam type of questions. That's one. Lastly, I'm going to provide and rationalize questions per each board exam type of questions. So right after I give you the question and reveal to you the answer, I'm going to give you the rationalization. Now let me share to you the instructions for today's examination. You'll be given 10 board exam type of questions. I'll be reading the questions and the choices for you. You have 5 seconds to answer each question. The answer is revealed instantly after each question with rationalization. You choose the letter of the correct answer. Good luck, nurses. If there's anything that I want you to take away out from today's exam, that is the rationalization. I don't want you to focus on how high your score is because that's not your main focus for today. Whenever you do a nursing test banking, that's your ultimate goal, to learn as you answer the question. Of course, we want a high score and I would love to know your scores. So please put them down in the comment section. And no shame about it, but the main focus, the main idea is for you to introduce on the structures of the questions on your licensure examinations and also to learn how to, the methods and how are you going to approach certain questions. All right. So, hingang malalim, take a deep breath because Here we go with our very first question for today. Board exam type of question number 1. During a routine checkup, Nurse Marian assesses a male client with acquired immunodeficiency syndrome or AIDS for signs and symptoms of cancer. Now, question. What is the most common AIDS-related cancer? Very straightforward. Binigyan ka lang ng background. But the main question is, what is the most common AIDS-related cancer? Sa mga pasyenteng may AIDS, ano daw ang kadalasang merong cancer sila? Is it A, squamous cell carcinoma, B, multiple myeloma, C, leukemia, or D, Kaposi sarcoma? Your 5 seconds starts now. Time is up, you guys. What is the answer? Very good. Kaposi sarcoma or Kaposi sarcoma. Now, Kaposi sarcoma is the most common cancer associated with AIDS. Squamous cell carcinoma, multiple myeloma, and leukemia may occur in anyone and aren't associated specifically with AIDS. The answer is letter D. Malinaw ba yan? Malinaw. Let's proceed. Question number 2. Ricardo is scheduled for a prostatectomy. That is the case. Prostatectomy. Removal of the prostate. And the anesthesiologist plans to use a spinal subarachnoid block or spinal block during surgery. In the operating room, the nurse positions the client according to the anesthesiologist's instructions. Why does the client require special positioning for this type of anesthesia? So, sa mga nagsa-spinal block, bakit daw kailangan merong special positioning kapag nag-administer tayo ng spinal block sa pasyente? Ito ay nasa intrapartum stage na ha. Intrapartum. Nasa loob na ng ER. Ay, ER. Sabog yan. Nasa loob na ng operating room. Okay? Bakit? All about positioning sa pag-administer ng spinal block. Why? Anong rationale? That's the question. Is it A, to prevent confusion? Is it B, parang ako, confused? Is it B, to prevent seizures? Is it C, to prevent cerebrospinal fluid or CSF leakage? Or D, to prevent cardiac arrhythmias? Your 5 seconds starts now. Time is up, you guys. What is the answer? Very good. C. Spinal. Key term. Kung wala kang idea, gamitin mo itong mga choices to. Spinal. Ano makikita sa spinal cord? CSF. Alin dyan na may ito na talk about sa spinal? Sa spinal cord? CSF. Pwede ba ang seizures? Not specific to your spinal cord. Confusion? More on your central nervous system. To prevent cardiac arrhythmias? Napakalayo. CSF, letter C. Now, here's the rationale. To prevent cerebrospinal fluid, CSF leakage nga po ang tamang sagot. The client receiving subarachnoid block requires a special positioning to prevent what? CSF leakage and headache, and to ensure proper anesthesia distribution. Proper positioning doesn't help prevent confusion, seizures, or cardiac arrhythmias. Malinaw ba yun? Malinaw. Board exam type question number 3. A male client had a nephrectomy 2 days ago and is now complaining of abdominal pressure and nausea. The first nursing action should be 2. So if your case is you're catering to a patient who is 2 days post-op nephrectomy, ang chief complaint mo is abdominal pressure and nausea. Ano ang unang i-assess mo or your first nursing action? Is it A, auscultate bowel sounds? Is it B, palpate the abdomen? Is it C, change the client's position? Or D, insert rectal tube? Your 5 seconds starts now. Time is up, you guys. What is the answer? Very good naman kayo dyan. Very good, bebe. Letter A is the correct answer. Auscultate bowel sounds. Why? If abdominal distension is accompanied by nausea, the nurse must first auscultate bowel sounds. If bowel sounds are absent, the nurse should suspect gastric or small intestine dilation, and these findings must be reported to the physician. palpation should be avoided post-operative with abdominal distension. If peristalsis is absent, changing positions and inserting a rectal tube won't relieve the client's discomfort. Okay? All right. Next question, number 4. Wilfredo, with a recent history of rectal bleeding, is being prepared for a colonoscopy. Anong case mo? Colonoscopy ang pasyente mo. Paanong preparation? How should the nurse, Patricia, position the client for this test initially? So, ang tanong, ano ang initial position ng pasyenteng for colonostomy? That is the question. Pera pa ng sarili mo. Okay, let me read to you the choices. A, lying on the right side with legs straight. B, lying on the left side with knees bent. C, prone with the torso elevated. Or D, bent over with hands touching the floor. Sapukin kita. Your 5 seconds starts now. Time is up, you guys. What is the answer? Very good. Letter B. Lying on the left side with knees bent. Why? For a colonoscopy, the nurse initially should position the client on the left side with knees bent, placing the client on the right side with legs straight, prone with the torso elevated or bent over with hands touching the floor wouldn't allow proper visualization of the large intestine. Why you want to position your patient on the lying on the left side with knees bent? Rationalization for proper visualization of your large intestine. Period. Now, before I reveal the 5th question, kung hindi ka pa nagsasubscribe, nakakaya naman sa'yo. Mag-subscribe ka na. Go, I'll give you time. Thank you. Ito na tayo. Board exam type of question number 5. A male client with inflammatory bowel disease undergoes an ileostomy. Inflammatory bowel disease. Post-ileostomy. Eto. Okay? On first day after surgery, Nurse Oliver notes that the client's stomach appears dusky. How should the nurse interpret this finding? Interpretation ng finding mo post-ileostomy. Yung stomach daw, anong kulay? Dusky. How will you interpret this? Okay? Is it A, blood supply to the stomach has been interrupted? B, this is a normal finding one day after surgery. C, the ostomy bag should be adjusted. Or D, an intestinal obstruction has occurred. Your 5 seconds starts now. Time is up, you guys. What is the answer? Very good. Letter A, blood supply to the stomach has been interrupted. Change in color. Ano bang natural na kulay, di ba? Dapat pinkish, reddish, ganyan. Hindi reddish, bloody reddish, but pinkish. Alright. Now, what does this tell you? An ileostomy stoma forms as the ileum is brought through the abdominal wall to the surface skin, creating an artificial opening for waste elimination. The stoma should appear cherry red, indicating adequate arterial perfusion. A dusky stoma suggests decreased perfusion, which may result from interruption of the stoma's blood supply and may lead to tissue damage or necrosis. A dusky stomach isn't a normal finding. Adjusting the stomach bag wouldn't affect the stomach color, which depends on blood supply to the area. An intestinal obstruction also wouldn't change stomach color. Hence, the answer is letter A. Okay, board exam type question number 6. Bilisan natin to. Anthony suffers burns on the legs. Anong case mo? Burn. Which nursing intervention helps prevent contractures? Tinatanong ka sa mga pasyenteng suffering from burns. Alin daw nursing action ang magpe-prevent sa contractures? Is it A, applying knee splints? B, elevating the foot of the bed? C, hyperextending the client's palms? Or D, performing shoulder range of motion exercises? Your 5 seconds starts now. Time is up, you guys. What is the answer? Very good. Applying knee splints. Here's the reason why. Applying knee splints prevents leg contractures by holding the joints in a position of function. Elevating the foot of the bed can prevent contractures because this action doesn't hold the joints in a position of function. Position of function po, nurses, ha? Hyperextending a body part of for an extended time is inappropriate because it can cause contractures. So no sa hyperextension. Performing shoulder range of motion exercises can prevent contractures in the shoulder but not in the legs. Malino ba yon? Are we clear? Absolutely. Let's proceed. Question number 7. Nurse Ron is assessing a client admitted with second and third degree burn on the face, arms, and chest, which finding indicates a potential problem. Anong sitwasyon mo? Tinatanong ka ng assessment findings mo. Meron ka daw client who is admitted for second and third degree burns. Ano yung dapat makikita sa assessment finding mo kapag ang kaso mo is second and third degree burn? That's the question. Is it a partial pressure of arterial oxygen, PaO2, value of 80 millimeters of mercury? B, urine output of 20 ml per hour? Is it C, white pulmonary secretions? Or D, rectal temperature of 100.6 degree Fahrenheit or 38 degrees Celsius? Your 5 seconds starts now. Time is up, you guys. To answer this question, I'm going to give you a tip. What are the common problems for patients who is suffering from burns? Dehydration. Alin dito may kinalaman sa dehydration? Letter B. Urine output of 20 ml per hour. I'll tell you why. A urine output of less than 40 ml per hour in a client with burns indicates fluid volume deficit. This client's partial pressure of oxygen or partial pressure of arterial oxygen, yung PaO2 value falls within the normal range, 80 to 100. White pulmonary secretions also are normal. The client's rectal temperature isn't significantly elevated and probably results from the fluid volume deficit. Hence, the answer is letter B. Okay? All right. Let's proceed. Last 3 questions na tayo. Make this one count. Mr. Mendoza, who has suffered a cerebrovascular accident, CVA, is too weak to move on his own. Binigyan ka ng background ng case. To help the client avoid pressure ulcers, Nurse Celia should, di ba? Ang layo, ang kaso mo CVA, pero ang tanong talaga, positioning. Positioning to avoid pressure ulcers. Oops, binigay ko yung sagot. Sorry. Pero ang tanong talaga is about pressure injury. Oh, pressure injury ha. Okay, sa mga bedridden. Paano mo daw to mape-prevent ang pressure injury? That's the question. Kahit hindi mo alam yung konsepto ng CVA, ang tanong naman talaga about sa pressure ulcer. Ito na siya. Paano mo siya ipe-prevent? Is it A, turn him frequently? B, perform passive range of motion or ROM exercises? C, reduce the client's fluid intake? D, encourage the client to use a footboard? Your 5 seconds starts now. Time is up, you guys. I kind of give away the answer to this one. Very easy. Bonus question. Letter A is the right answer. Turn him frequently. The most important intervention to prevent pressure ulcer. Sorry. All right, let me say that one more time. The most important intervention to prevent pressure ulcer is frequent position changes, which relieve pressure on the skin and underlying tissues. If pressure isn't relieved, capillaries become occluded, reducing circulation and oxygenation of the tissue and resulting in cell death and ulcer formation. During passive ROM exercises, the nurse moves each joint through its range of movement, which improves joint mobility and circulation to the affected area but doesn't prevent pressure ulcers. Adequate hydration is necessary to maintain healthy skin and ensure tissue repair. A footboard prevents plantar flexion and foot drop by maintaining the foot in the dorsiflex position. The answer is letter A. Frequent turning nga po, depende yan sa SOP nyo. Q2, normally Q3 hours ang positioning natin. Okay? Alright. So let's proceed. Board exam type question number 9. Nurse Maria plans to administer dexamethasone cream to a female client who has dermatitis over anterior chest. How should the nurse apply this topical agent? Ang tanong, paano ka mag-administer ng dexamethasone cream sa female client on the anterior chest? That's the question. Is it A, with a circular motion to enhance absorption? B, with an upward motion to increase blood supply to the affected area? C, in long, even outward and downward strokes in the direction of hair growth? Or D, in long, even outward and upward strokes in the direction of opposite hair growth? Your 5 seconds starts now. Bago ko i-reveal yung tamang sagot, you guys, kung hindi ka pa nagsubscribe, aba naman, nakakahiya naman sa'yo, mag-subscribe ka na. Eto na talaga. Hindi ka magsusubscribe sa channel ko, alam mo kung bakit. Hindi ka magsusubscribe sa channel ko dahil inuutosan kita. Magsusubscribe ka sa channel ko kasi alam mo na malaking tulong ito sa pag-aaral mo. At malaking tulong yung mga contents na ginagawa ko para mapadali ang buhay mo sa nursing. Kaya naman, mag-subscribe ka na and hit my notif bell. It is a must. I love you. The answer to this one, anyways, the answer is letter C. In long, even outward and downward strokes in the direction of the hair growth. Why? When applying a topical agent, the nurse should begin at the midline and use long, even outward and downward strokes in the direction of hair growth. This application pattern reduces risk of a follicle irritation and skin inflammation. Malinaw ba yon? Malinaw. Last question for today's examination. Make this one count. Question number 10. Nurse Kate is aware that one of the following classes of medication protect the ischemic myocardium by blocking catecholamines and sympathetic nerve stimulation is, ang tanong, alin daw dito sa mga group of medications na to, the choices na to, ang responsible for sympathetic nerve stimulation, blocking the catecholamines and sympathetic nerve stimulation? Very straightforward. Is it A, beta adrenergic blockers, B, calcium channel blocker, C, narcotics, or D, nitrates? Your 5 seconds starts now. Nursing pharmacology. Nursing concept, you guys. Turn off my alarm. What's wrong? Alright. So, what is the answer? Very good. Beta adrenergic blockers. Beta adrenergic blockers work by blocking beta receptors in the myocardium, reducing the response to catecholamines and sympathetic nerve stimulation. They protect the myocardium, helping to reduce the risk of another infarction by decreasing myocardial oxygen demand. Calcium channel blockers reduce the workload of the heart by decreasing the heart rate. Narcotics reduce myocardial oxygen demand, promote vasodilation, and decrease anxiety. Nitrates reduce myocardial oxygenation consumption, but decreasing left ventricular and diastolic pressure, or yung tinatawag nating preload, and systemic vascular resistance, yung afterload. Hence, the answer to this question is letter A. Alright, dyan na nga natatapos ang ating discussion for today's video. Thank you so much for watching. Hope you learned something. Please like, share, and subscribe to my channel for more nursing educational videos. Don't forget, alam kat. Let me know if you have other nursing topics that you want us to do. You comment it down below. Tulungan nyo na nga ako, ipamalitan nyo na sa Radyong Sira, pinakabago, pinaka-fresh, at pinakalibreng nursing review center sa balat ng YouTube. Don't forget to follow me on all my other social media accounts. Everything is at Neil Gabe except for my TikTok account, which is Neil Gabe Official. Follow me on my Facebook page, It's Neil Gave, and also check out, subscribe, and follow my podcast channel. It's 3 a.m. Conversation with Neil Gave. I'll see you again next week. You have a good weekend.